Having been performing bariatric surgery now for 15 years, we are seeing a number of patients who come back wanting to discuss the options for revisional bariatric surgery. There are a number of different reasons why you might consider revisional surgery. Some of the older surgeries have been associated with complications or issues, particularly reflux, and increasingly, unfortunately, it's becoming an issue with the sleeve gastrectomy. Recent studies show about 35% of sleeve patients may develop reflux with time, and obviously the longer you are from surgery, the more likely that might occur. And a small percentage of those patients, the reflux is so severe that they would consider revisional surgery, which is usually a conversion to Roux-en-Y gastric bypass to manage their reflux disease. The other reason that people come looking or wanting to talk about revisional surgery is obviously weight regain. Over the years, all forms of bariatric surgery do have some degree of weight regain. As I've said earlier, because we've got the team approach with the dietitian, psychology, focusing on lifestyle change, our percentage weight regain is lower than the national average, but some people will come back with results that they're not happy with. Obviously, patients who come back with weight regain are concerned that they're going to get back to where they were before. They can regard themselves as being a bit of a failure, that they couldn't manage their weight with the diet and exercise, and now they can't manage their weight having had a bariatric operation of some sort. We now talk about, rather than talking about failure of weight loss surgery, we tend to talk about responders and non-responders. In the same way, somebody who has high blood pressure may start on one tablet, and that might last them for a few years, and then they may need to have another tablet added in, or they may be switched to a different tablet. It's the same with weight loss surgery. You may start with one operation, and it may not last you a lifetime. You may need to be changed to a different operation. So we don't like to talk about success and failure. We like to talk about responders and non-responders. When it comes to someone who comes to see us in the practice who's had some weight regain following bariatric surgery, whether or not they're one of our previous patients or they've had their surgery somewhere else, we have a tiered response to how we manage that. The first thing we always do is have a look at diet and lifestyle. So we encourage an appointment with the dietitian, an appointment with the psychologist. Let's look at what you're eating, when you're eating, why you're eating. Is there something we can tweak in your diet to try and get a bit more out of the operation that you already have, and therefore avoid the need for any further surgery? The next step, we can consider some medical therapy. So there have been some recent injectable drugs that came from the diabetic medication and have been rolled over into weight loss because they've been shown to have reasonable weight loss results. So one option with someone who's regaining weight or is not happy with the weight that they've lost is we can add in some medical therapy. The final step then after that is to consider revisional surgery. Obviously, revisional surgery in any branch of surgery carries higher risk than the primary operation. So this is something that has to be considered carefully. There are a number of different operations that I perform, and depending on each individual patient's circumstance, I can recommend one over the other, and we can go through that process. We do like you to take some time to consider it. We won't jump straight in and offer you surgery straight away. Generally, I let the patients decide that yes, I've reached a situation where things are bad enough. Now that might be from a reflux point of view, or I've regained enough weight that I'm willing to consider a revisional procedure. So in the practice, we try and tailor everything to the patient, provide you with lots of support, but that's the sort of process we go through when it comes to revisional surgery. So if you have had previous surgery, you're not happy with your results, or you're suffering from issues, particularly reflux, feel free to phone the practice, make an appointment. You can come and see Shirley, the practice coordinator, for free, and have a chat and discuss your options in more detail.